So this is a septal graft, which I have obtained now from this patient's nose. I'm going to use on the dorsal. So I would use now fascia lata to support my graft, and I'm sure I'm going to do it. So we have the fascia lata, as you see. We have the tissue glue, and we'll put the tissue glue here all the way through, and then we'll get non-tooth forceps, the graft. We'll fix the graft there, as you see now. Okay, we'll keep moving the graft. Wait for about a few seconds. So the graft now, as you see, fixed to the fascia. So we get now our knife. Give me marking pen. And I will slide the graft in the middle like this, first of all. So just scoring the graft. So when I do it on the fascia, so the graft will not split into two halves. Interrupted split, you see, interrupted. And then again, what I will do in my campaign, I will make cross hatching like this. Cross hatching like this. And again, the cross hatching the opposite way. So the graft, you see now, is open. You see, it's open like this, it's open like this, and open like this also. Open like this in both directions. So which makes the graft is going to ride on the septum. It's going to be riding. So we got the, you see, the graft is open in both directions. So it's going to ride on the septum now. We just will make another two and suture it now. Suture it now. Opposite way. Hold it opposite way. Yeah. Okay, I think go. So the graft is wrapped nicely, and it will open like a book when you press it on the septum later on the dorsal, when you press it, on the dorsum. And let's look at the graft again and see the direction. Our direction was this way. Make sure which direction we were before. The direction, yeah. That's our direction before. There. So give me the suture again. So we want the graft to suture just slightly under tension like this to prevent warping. So you can do one more suture like this. Sorry. The opposite way. This is to prevent warping also. So this is a septal graft now. It will go, you see, nicely now. It will open like a book. It will go there. Of which You have to soak it. Okay. So no sharp edges, remove the sharp edges from there. Okay, and give me non-2 forceps. And we just soak it with antibiotic first, Cibrobay antibiotic, and then push the graft to place there. We made an exact pocket before, and you see now, it's nice exact pocket at how much definition. And then you brace as exactly when you do for the hand push down, you brace. So when you brace, the graft will split slightly in all direction and open there, and it will ride the dorsum nicely, as you have seen now with this very nice profile after the patient has got some mild settling. So we braced on the graft's exact pocket, and we braced on the graft, as you see, because we slide the graft will open now, and it will ride on the dorsum. It will, as you see, very nice dorsal projection. Also, there's another option. If you don't want to make the graft so thick, you put only the fascia on one side, and you see we already slice the graft. You see how the graft is sliced and open now in all direction. You see, it's already sliced and open, and you can insert the graft. Already the graft being attached to the fascia with the glue. Give me non-2 forceps. That will make it nice, and it will ride nicely. The dorsal. That's another option because I found it quite thick. So that is much better now. You see, if you look now, it's much better than before. It was slightly high before, so I made it now in a much better position now. Very quite nice dorsal projection. So you have the two options if you want to use it either thick or slightly thinner. This is Bizrah from our Rhinoplasty Bizrah Academy in London and Dubai. Thank you.